about to start doing an immediate load prosthesis for the mandible for a patient who presented to us yesterday. We restored the maxilla with an immediate load function prosthesis, and today we will do the mandible. The reason we do that is that we split it up in 2 days for patient comfort. It's a bit too much doing the whole procedure for maxilla mandible in 1 day. So what we have here is pretty much a setup for immediate loading one arch. We've got the prosthesis, we have some blue mousse to pick up the position of the implants and the abutments, and it's really split into 2 sections. One section is for the pickup, and we're going to use the GC pattern resin to pick up with a brush the position of the implants. We will show you, and we're going to use these temporary copings that you can see here. And if you zoom in on that, there's the coping, and the code for it is referenced, so you know which component to order for an abutment level and pickup. Okay, so we need 4 of those. We will do the pickup, and once we've done that, we will move on and go to the laboratory phase and start filling in the voids and doing the actual conversion. And we use this material called Pro Base. It's a very strong cold cure material, and once we've added that, we cook it inside our pressure pot. And this is a very convenient pressure pot for a dental practice rather than dental lab. It's fairly inexpensive, it's easy to use. And after the polishing conversion, I'll show you how we do the polishing. We use some material like Teflon and a bit of Cavit to close the chambers. And we can go through the process of what actually happens in a minute. So let's start by looking at trying the denture in the patient's mouth. So what we have here is our denture, which we will convert. And what I'd like you to note is these extensions. And these are what gives it the stability for the time where we're loading. So we need those big extensions so it doesn't move around. So the restoration is placed, and it's very stable. And we haven't even done any internal adjustments to check for any interferences, but we just want to see if we're about in the right place. And we ask the patient to bite together for me. And we are very close. I mean, the midlines are coincident, the occlusion's almost perfect, and we haven't even done any internal adjustments. That's all can be attributed to the proper planning, good osseous reduction, and so we're pretty close. You see we've got some blue material inside the denture. Be generous, and then we just go to the mouth, and we just want to obtain the same position that we had. Bite on the back teeth like we practiced. That's it. You see, we just go straight to the correct position. That is exactly what we planned in our wax up, and we have it. So now our job is to maintain that position throughout the pickup phase. So now we remove the prosthesis, and we've got 4 indentations of where we need to make some drill holes. The other feature that I like to do for these prostheses is that we will not be making cantilevers at this stage. The prosthesis will not have a cantilever. So we always have only 1 bicuspid and 1 molar on each side, you see? And that will allow us a nice setup and to avoid 2 bicuspids, which some patients don't like aesthetically. And so later we have the luxury of adding an extra tooth on each side if we needed to. And so those are the indentations. We literally need to just make some holes and access through to the outer surface of the denture. Okay. See, and come through quite a nice position on that molar without damaging the buccal cusp. And we can widen it. So that is an acceptable position. And I like to reduce this in height on the lingual. That way I can engage the temporary cylinder quite nicely when I'm loading it. So then we make some more holes. Again, exactly the same position. Dr. Jovanovic's done a beautiful job with the implant placement. Got a good AP spread. And again, we make this long like that so we can really engage that lingual aspect of the temporary cylinder with GC pattern resin. And be generous with your reduction. Okay, so we need 2 more holes. See, beautifully positioned implants. And I'm quite aggressive with making these holes. Okay. So now we can remove the blue mousse after we've just maybe tidied these up a little bit. So the next phase is to put Vaseline on the sutures so we don't connect to them. Okay, very good. You can hold that. And what we have here, we've got 2 screwdrivers. I like the short and the medium length. The short one is the one we remove the white caps with, and the medium length is the one we put the temporary cylinders on because they're just a little bit taller. So we remove what we didn't do is to just quickly, so before actually we remove them, it might be an idea just to check that we are in the right place. It's always good to check what we're trying to do. Okay, bite together again. Bite. So we know that's our occlusion. So with our mirror, we want to see whether there's going to be any interference. Now, there probably will be a little bit, so we need to adjust it now as much as we can. So now we want to look at these chimneys, make sure they're clear, a nice clearance around each chimney that's going to be inserted. I think we're in the ballpark. So we will start removing the white caps and replacing them with the temporary cylinders. Second. That's it. That's a good sound. I'm trying to remember the emergence of the pins, the guide pins that we had, and there were. So once you do that, the screw engages quicker. And so we need the denture again. So there will be some interference, and so we check to see if the ideal position of the denture is shifted. And see, it's like tilted distally a little bit on that one. So we relieve it just there. There was a bit of a connection right there. So we just relieve. And it's pretty good. So bite together. So now it's coming forward a bit. So that means there's an interference, which I don't like. So open, see. So it's coming forward. That means that one, you see, that one's engaging. Does that make sense? The denture came forward, open, so it's there, right there, that is touching. So the midlines are lined up. It's actually has a tendency to go this way. So I'm going to see if there's an interference. You see? So I need to push this that way. Right? Slightly, not much. So I want to see, open up for me, Thomas. Open, 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 open. You see? So what I'm saying is right there. Is it bite together? That's it. You see, its midline's perfect now.
Yeah.
White acrylic?
Mm-hmm.
So we can just do some marking now. Bite up and down, tap, 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 and hold it. And you see we have contacts evenly everywhere, which is really good. But we want, so what we need, open, I want to make sure that we have no contacts on the back. So we got even contacts there, 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 and there. But I want to get rid of the posterior contacts for this phase. So we can do it on the upper.
Yeah, no,
And bite again. Tap, tap, tap. And hold it. Open. Bite. So I've got one spot here which is a little bit heavy on the front. So we just want to make it even them out as much as we can. We pretty much have a contact on every single tooth. But my aim is to actually eliminate posterior contacts for this phase. So we've got beautiful contacts now on all the anteriors. Just need to reduce the contacts on these molars, and we are good to go. So this is silver mylar. It's about 12 microns thick, and it will just give us an idea about the occlusion. Open up, Thomas, bite together. And the posteriors are open, you see? Karen, can you retract that for me? So as planned, for this phase, we want the posteriors to be open. Bite together, and it's open slightly. Perfect. Open, bite. Because the muscle force is so high in the back. Open, bite. That's perfect. Open, bite. Nice and hold. Open, bite. So all our contacts on the front. Open, bite. That's lighter there. Open, and bite. Actually, this one has a contact, so I need to eliminate the one on the left. Open. So just a minor modification. And Thomas, bite together. Tap, tap, tap. Tap, tap. And hold it. Open. That's beautiful. Okay, so now let's remove it. Open, 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 open. So the next phase is to check, make sure these are stable. See, there's no movement. And we really didn't need a rubber dam because we controlled the acrylic resin beautifully. It's way away and it's very secure and locked in. So it's perfect, ready to do the conversion. So before we do the conversion, it's important that we put these white caps back on so that the tissues don't collapse. It's almost like Morse taper, you know, it finds its way. You just need to guide it slightly. Okay. These components here are called the guide pins. Ideally, actually, I'd like to get some much longer guide pins. But I'll show you a trick when you have short guide pins, how to bypass a particular problem. And these are called polishing protectors that different implant companies make. These are from Nobel Biocare. And the polishing protectors protect the actual inside or intaglio surface of your temporary cylinder from getting damaged. So it's very important that we use these. The guide pin goes on there. And the polishing protector goes on there like that. And it literally just gets screwed in. You've connected the polishing protector with the guide pin to this situation here. And so no acrylic resin is going to go in there. The other important thing that we will try to do, and it's always a little bit tricky, but it's what we try to do, is that we would like the acrylic resin not to go above this position. This is the polished collar. Okay, so we fill it up until it rises to that level, and then we cook it, not much higher. And so that's part of the plan to make sure it's seated fully. And the beauty of this is that a dentist can easily do it. You don't need to bring a laboratory crew to do this for you at a huge expense. It's something that clearly, with our skills as a dentist, we can easily manage this. Okay, so the next phase, so these are now in, they're secure, they're all stable, there's no movement, so we can connect them up. So let's now mix some acrylic resin. Make sure our pot is ready. So we get some material like that. This is the Pro base, probably might be a little bit too much liquid. And with the aid of this spatula, we can start mixing it. We need a little bit more powder. Just a fraction too thick. Still too runny. It's getting better now. That's a much better consistency. Perhaps a fraction more liquid, just to give it a bit of flow. And strength at the same time. Not the liquid, just that consistency will give us the strength. Pour it in so the top part's open. And then we just flip it, let the air out, let that bubble rise to the top. You see the bubbles at the top, and now the air comes out. So very simply, we start injecting, as I said, to the polished collar, no more. So wet brush would be great. Wet brush. With this monomer. See, very easily we've managed to get what we want. And so just with the right consistency, you can really get there fast. And it's setting. Ideally, you need some compressed air to be able to do this, but you see the pressure goes up. If you fill it up with water right to the top, you don't even need compressed air. We got 30 pounds of pressure almost by just me turning it. You can focus in on that. Right? Just by the density of the water filling it up to the brim. And the temperature is not like, it's like cold tea, not too hot, because if it's way too hot, what will happen is that it will evaporate the monomer and you start getting voids in it. So it should be warm enough to accelerate the cooking, but not too warm or too hot that will make the water evaporate, the monomer evaporate, and to get bubbles incorporated in it. Always put it in upside down. So basically the area that you worked on should be facing upwards. So the bubbles move away from the structure, not into it, and create a porosity. Good, so we'll wait 5-10 minutes and then we'll reconvene. Okay, so we managed to get our prosthesis out of the oven. We've got a good amount of acrylic for trimming back, and we got a decent amount on this side. I trimmed back the red stuff, the GC pattern resin. After reinforcing on this side, I trimmed it back and just added some pink, and you see we already have some nice color there. And this is a good technique actually. Just by Q-tips are a great resource in dentistry. We dipped the back end of them in some Vaseline, put them inside the chimneys, and then built it up with white material. And very easily you can remove it, and you have a beautiful chimney on both sides. Okay? So now we've added some tooth-colored material there, some pink-colored material there, and we have all the foundation for trimming back and making a nice immediate load prosthesis. And with the implants being in the right position and the fact that we've got one bicuspid and one molar on each side, we don't even need to cut any teeth off. So that's a real good tip to giving the patient a good shortened dental arch and have a good distribution and a number of teeth back there for them to be able to chew on. So let's now start trimming it back. I think about 20,000 RPM is a good speed. But what you don't want to do, so you don't damage yourself, is that you don't want to embed it in there and keep it in there. With the disc, you have to keep going in and out gradually. And by doing that, you don't engage it and make nice cuts. So I'll show it to you. Put your foot all the way down and just press, release, press, release, press, release. And very nicely, you can get a nice cut. So don't engage it because it will lock in and then it can engage and it can cut yourself basically. So take your time and just chip away at it, and the disc does a beautiful job. You see it engaged a little bit there. Again, press, release, press, release. Again, press, release, press, release, press, release. See, anytime I engage it, it grabs it. So just, again, press, release, press, release. It's like a jerky motion almost. And then it just breaks off. So we can go around. And the disc really does help us save a lot of time. Just keep an eye on this side before you cut. So you need to blend it in like that. Again, in, out, in, out. Any resistance, you keep chipping away at it. This is the equivalent of the piezo for pros. And then we just break it away. Same, exactly like the piezo. So we now chop off the distal. Again, chip away. We have, I think, enough to be able to start trimming it with a burr. Maybe even this section we can just trim off like that. Okay. This is where we put the speed back up. This is great. So we know that we can do all of this in a normal dental practice environment. We don't need a lab. So my main purpose here is hygiene. I need a convex tissue surface so I'm beveling everything towards the incisal edge, and so this area will be accessible. Then close those areas up. At the moment, I really don't want any tissue contact in those areas. You can scallop it a little bit or festoon it. Keep it convex up there so we don't get food stuck. This will be a very nice hygienic prosthesis, particularly because Dr. Jovanovic has done appropriate bone reduction for us. That really is the name of the game. If you decide to do this prosthesis, you have to do the right amount of bone reduction. Otherwise, you will end up in difficult situations during the final and the provisional phases. You want to bevel the lingual for hygiene. Again, the easier access, the better. These areas have to slope down this way and slope down that way. That's my most important concern. Everything else is secondary. Aesthetics, fatter on that side and that side. So I just want to balance it out so the tongue doesn't just go into an area that is a bit less even than the other. So get it about the right dimension on both sides. And remember, the purpose of this prosthesis is primary stability. It's cross-arch stabilization. Right? And look at it, it's rock solid. This is going to stabilize those implants. Get rounding off. That's all I'm doing. Almost like a sphere. I mean, as close to that as possible. And look at this, the polished color is all exposed. You see the polished colors? And so that means we're exactly at the right height. 7,000, let's try that. Yeah, that will give you enough control to really create some nice anatomy. Open up some of these embrasures, but not too deep, because it can create a crack line. And look for any excess acrylic resin that may have crept into little embrasure spaces. This is the time to remove it. And when you adjust the incisal embrasures, always approach from the palatal. Otherwise you'll be too aggressive. You see there's a bit of resin there, we just engage it. These blue spots we remove. I really don't want any posterior contacts. Remember, the contacts are going to be on anterior teeth. There's 200 pounds of pressure on the second molar. There's 20 pounds of pressure on the anterior tooth. All the loading should be on the anteriors. And feel it with your fingers. I get some paste. I put it on the wheel. Really, you need this lathe to do this job. You got some Ajax as well. And a toothbrush, Issa. Again, a lot of movement. Don't keep it still, otherwise it will burn the acrylic. A lot of movement, rotation, to really get that buffed up, hygienic, so we don't want plaque to attach to it. I'm happy with that. Okay, so we rinse it now. And this is a nice little trick at the end, is that we use Ajax to clean it, it kind of disinfects it and really gets a lot of the surface debris and organic material, anything we may not want off, with a bit of water. Really scrub it. Before you give it to the patient. Okay, let's rinse it now. Really get into okay. So that looks pretty good. Nice emergence, beautiful shape. It's ready to be loaded. So we just want to insert the prosthesis. The tissues are going to be in the way, they always are, so we just a bit of pressure to just push the tissues out the way. So we want it to be open in the back, bite together. You see it's open, bite, nice and open. You just need to refine the bite very slightly. Open up for me, and we mark it. Tap, tap, tap. And hold it. Open. And we have pretty decent contacts, evenly distributed, and it's open in the back. Bite together. Open, bite, open. And so we know we're open in the back, but we're getting some marks. And we got nice 6 nice anterior contacts. So I wouldn't do any adjustments.
When we do it as planned as this, it's like, it's easy.
Yeah. I mean, the beauty of this case, I think, was the fact that we didn't use a guide. It was just communication, experience, controlling it. So,
well planned.
Yeah, if you've planned it through, I think it works out quite nicely, very easily. Thank you so much, Dr. Ivanovich. Looking to many more.